One of the questions is that they're hearing less and less about COVID cases in Orland Park, and can I provide an update? I want everyone to remember that we took all of these mitigation measures to protect our hospital system. Currently, 3.9% of the hospital beds in Illinois are used by COVID patients. 11.3% of ICU beds are used by COVID patients. Additionally, 24% of hospital beds and 20.3% of ICU beds are open in the state. We have been repeatedly told that children are driving these numbers. The fact is, as of late last week, there are four children under 18 in the hospital with COVID in the entire state of Illinois. We have also seen advertising on TV and billboards stating that 99% of COVID hospitalizations are unvaccinated. This is also not true. 9% of hospitalizations since April and 11% since mid-September are of vaccinated people. Additionally, since April, 19% of deaths were vaccinated and 22% of deaths since mid-September were vaccinated. Why does the state have to lie to us? Why not just give us the facts? Instead of facts, the governor, IDPH, and ISB have resorted to changing what is reported, fear, and threats. We have already witnessed a parent have rights taken away because they themselves weren't vaccinated, and a downstate doctor have his medical license reviewed because of his votes as a school board member. Mark my words, more of this is coming, as evidenced by a Senate committee voting to make the Healthcare Conscience Act inapplicable to COVID mandates. This is a precursor of what is to come when they mandate children get vaccinated and parents don't comply. If you think this is an overstatement, keep in mind that our first responders and medical personnel took great personal risk to care for people throughout COVID, and particularly at the beginning. Now, if they refuse to give their vaccination status, or if they make a personal decision to not get vaccinated, including those that have had COVID, they are being fired. The governor, legislators, and others do not care and never have cared about our first responders. They were unwilling and unable to get them the proper PPE. They tried to make criminals out of our police with HB 3653, and now they're firing them and putting the public at risk. The governor and legislators' actions speak way louder than their rhetoric. What they are doing is immoral and disgusting in the name of power and control. People have the right to make their own informed decisions and should consult their physicians and decide what is best for them. Here in Orland Park, we will continue to keep people as informed as we possibly can and support your rights to make your own decisions. We also will not enforce these mandates, as we have said repeatedly. The people of Orland Park have shown that they will make good decisions. To make good decisions, it is important that we are given the facts. The fact is that our elderly population and those with other health conditions are by far the most vulnerable to COVID, and that children are less impacted by COVID than they are the flu. This was true in March of 2020 and remains true today. If you are in one of these vulnerable groups, please consult your physician and make the decision that is best for you. Additionally, the facts are clear that the vaccinated are less likely to be hospitalized, but also vaccines are not a panacea, and that vaccinated people still get COVID. The bottom line, if you are sick, even if you're vaccinated, please call your doctor and get the appropriate care. There are treatments that are effective if given in the first 10 days, and your doctor can advise you on the best treatment for you to take.